Hi, this is Carrie Mahalski, Certified Nurse Midwife from Thrive Midwives, talking to you today about hypertension in pregnancy. So let's get down to risk factors for high blood pressure in pregnancy so that you feel like you can improve your health, take proactive action, and also understand your own risk factors. Women are having children at later and later ages or delaying the start of their families until their 30s and sometimes early 40s. Many women are starting their pregnancies overweight or obese. Both of those factors, both age and weight at the onset of pregnancy, can have a significant effect on your risk factors for hypertension in pregnancy. I highly encourage all women to go and see a highly trained care provider for what's called a preconceptual visit. That means a visit that you do before you've even conceived your baby, before you've become pregnant. This is a perfect opportunity to have your blood pressure checked. It's a great opportunity to discuss with your care provider some lifestyle changes that you may be able to implement that could decrease your blood pressure and thereby decrease your risk of developing hypertension in pregnancy. If you are carrying more weight for your height than is typically healthy for most women, this can be an opportunity to discuss strategies for decreasing your weight, increasing your exercise or your fitness in order to enter pregnancy in a healthful manner. Another thing to consider is particular to women who have what is called white coat hypertension. That means women who otherwise have a normal blood pressure outside of their clinician's office or clinic, but when they are in clinic, their blood pressure is through the ceiling. Now, frequently this is caused by anxiety people have about being in a care provider's setting. What I typically encourage women to do is to check their blood pressure at home in the morning and send me a picture of their blood pressure reading. It helps me as a caregiver make sure that I'm not diagnosing somebody with high blood pressure in error. Make sure that you're having routine prenatal care so that they can monitor your blood pressure during pregnancy at appropriate intervals. Also, find out if you'll need to transfer care to another care provider if you develop high blood pressure during pregnancy. Lastly, this is a tip for women who had hypertension during a previous pregnancy. It is crucial that you are seen by a highly qualified care provider annually at regular intervals so that you can have your blood pressure checked and your lipids or triglycerides screened routinely based on your age and your risk factors. It is well known in the research and in the medical community that women who've had hypertension during pregnancy have higher risks of developing cardiovascular disease in the future and sooner than the typical population who's never had hypertension. I hope you've enjoyed today's video on hypertension and pregnancy. So thank you for joining me and have a good night.